Hello students, in this session we are going to discuss female external genital organs. Now the female external genital organs, these are many organs here, see that, and these organs will come when there is the opening of the vagina. Opening of the vagina means this is called vaginal introitus, and after the vaginal introitus, this vaginal introitus will be guarded from all sides by the genital organs. These are called the external genital organs, which are very important for the sexual purpose, and at the same time they are important for guarding the openings into the openings of the vagina as well as of the urethra. And all these structures together, you say that all these structures which we will discuss, like for example one is called the mons pubis. The mons pubis, you see that mons pubis is a collection of the fat along with the overlying hairy skin in front of the pubic symphysis and pubic bones is called the mons pubis. You see in this diagram, this is the mons pubis. This area is called the mons pubis. You see, this is all is hairy skin, a lot of sebaceous glands, and this is in front of the pubic symphysis and the pubic bones here. This is called mons pubis. This is one thing. This is a mons pubis, and this is a mons pubis. This is one structure of among the external genitalia. You see that, and this mons pubis, this amount of fat here, and this underlying the skin, hairy skin with the great sebaceous glands and pigmented skin here. But this mons pubis, which is lying actually in front of the pubic bones and the pubic symphysis, it will extend backward here, and when it extends backward, it will split into the two folds here. You see in front of the pubic symphysis and the pubic bones, it is single, and it will extend backward. It will split into the two now. So it is not a single paired now. It is actually a paired now. The paired pairs. It's again the same as hairy skin. It's not just a hairy skin, but it will be again with underlying lot of fat here, subcutaneous fat, and these folds of skin, hairy skin, which extend from the mons pubis and will go backward here, and posteriorly you see that, and then again they will join together and they will go backward here around the vagina, around the vaginal introitus, and will go back and will unite together at the back here. You see this here, these are the two folds here. These are the two folds which are actually, these are again the fatty parts, which are in fact continuations of the mons pubis. It's the same hairy skin, underlying lot of fat here. This is called labia majora. Labia means lip, majora means major, larger lip. It's a labium majus, is one single is there, but this is two, that's why we call them labia majora. This is again same, again see composition is almost same, just like you see composition of the mons pubis. So this is again hairy skin with a lot of sebaceous glands here, and this is having a lot of subcutaneous fat here underlying that. This is called the labia majora. And this labia majora, posteriorly you will see that this labia majora, it will fuse here, and you can say behind the, behind the vestibule, also behind the vagina, they will fuse here. This is called posterior commissure of the labia majora. Posterior commissure. At the same time anteriorly also, but posteriorly behind the vagina, you see this becomes a little faded here, but you see this is a posterior commissure, and anteriorly it is also, you see anteriorly it is also having the anterior commissure. This is the anterior commissure. Now these are the two labia. We see labia majora, and these labia majora, they are the homologous of, you see that they are, in case of male, these labia majora, in fact they will form the scrotum. If you remember, if you recall your memory and you see remind of some of your embryology, you watch here, if here is the cloacal membrane On the two sides of the cloacal membrane, there are bulgings, we call them urethral folds and the anal folds. On the sides of urethral and anal folds, there are these bulgings here, these are called genital swellings. These basically are genital swellings. If these genital swellings will fuse here, in case of male, a pouch will be created. So, in the labia majora, you see these two labia majora, I told you that these labia majora, if you will remind of your, if you recall some of your embryology, and if you discuss that the GIT in fact are the primitive gut tube starts from the buccopharyngeal membrane and end at the cloacal membrane. If you consider this is the cloacal membrane, this is the last thing that is actually present here in the primitive gut, this is the cloacal membrane. On two sides of the cloacal membrane, there were two, if you remember, there were two folds here, these are called the urethral folds. And these urethral folds are actually present here, urethral folds. You see, urethral folds are surrounding the buccopharyngeal, I say surrounding the cloacal membrane, urethral folds. And these urethral folds are surrounded here by these bulgings here, these are called the genital swellings. These are two genital swellings. Actually, these two genital swellings, if these two genital swellings remain separate, they will give you here a gap. And that gap will be actually left between the two genital swellings. And these two genital swellings will be actually, bulgings will be there, underlying will be a lot of fat here, it is skin, it is hairy skin, there is a lot of sebaceous glands. In case of female, they are separate and there is a gap, and that gap in future will be called as the pudendal cleft. And these two genital swellings will give rise to, say, labia majora. And these labia majora are actually genital swellings. But in case of male, these genital swellings will expand, will join in the middle and will fuse to form their single pouch here. That will also be the skin, pigmented skin with the hair also, you will call it the scrotum. So that means labia majora, they are the homologous of the scrotum in case of male. So in case of female, these are the two labia majora. Because they fail to fuse here, so a gap is created here. So a gap is created, that gap between the two labia majora, through which we can enter into certain other external genital organs, and we can visit also certain other genital organs, but passing between, in a gap between the two labia majora. And that gap is called the cleft. It's a buttonhole type cleft you see that is present here in the middle, that is cleft is called the pudendal cleft. And that pudendal cleft is another thing you see, that is the gap between that. So that means the pudendal cleft is a fissure or a gap or a cleft, you see is a longitudinal cleft cordoned by the two labia majora. And this labia majora will be just like you see, that's just like the buttonhole, just like the fish mouth, and anteriorly it is fused and posteriorly also fused to form the commissures. And anteriorly this commissure is there, but this commissure is becoming continuous with the mons pubis. Mons pubis is the mound of fat underlying the hairy and pigmented skin in front of the pubic bones and pubic symphysis. So this is the mons pubis, and these are the two labia majora, anterior commissure, posterior commissure, and this is here. But if you remember that in the bottom of the scrotum, there was in case of male, in the bottom of the scrotum there was the testis here. Testis came here in the bottom of the scrotum, and who has tethered the testis from the lumbar region at the bottom of the scrotum? It was the gubernaculum. And gubernaculum's flagellar action in fact to pull the testis down there, down into the bottom of the scrotum, and after that it gets disappear. It has come here. So that means this gubernaculum is actually pulled the testis here into the bottom of the scrotum. Same thing in case of the female. In case of female, there is gubernaculum, but here is an ovary. Ovary came down now because of the gubernaculum, and this gubernaculum actually pulled the ovary into the pelvic walls, and between the pelvic walls, you see at the pelvic walls it went into the broad ligament. But gubernaculum continued here, it got fixed with the superolateral angle of the uterus. So between the ovaries lower pole and the superolateral angle of the uterus, that gubernaculum was called the round ligament of ovary. But you see gubernaculum program is same just like the gubernaculum in case of the testis here. So gubernaculum comes out of the broad ligament, will come into the extraperitoneal fat, will continue in the layers like fascia transversalis, then transverse abdominis muscle, external oblique, internal oblique, external oblique, until it will reach here to scrotum in that case, and labia majora fatty tissue in this case. In the posterior part of the labia majora, this gubernaculum will reach in this area. So it gets fixed with this. And this time this gubernaculum is called a round ligament of uterus. and that is passed through between the intermuscular cleft between the anterior abdominal vast lower portion. You call them, you call that as the inguinal canal. So this will be the content of inguinal canal in case of female. So that means in the labia majora this is present also, and this is called the round ligament of uterus, which is the one of the contents of the inguinal canal in case of female. That is why the inguinal canal is small as compared to the male here, because male contains the spermatic cord, but here no spermatic cord, just inguinal nerve and this round ligament of uterus. Round ligament of uterus is the say distal longer part of the gubernaculum. It is the remnant of the distal longer part of gubernaculum, and this gubernaculum ends in case of male pulls it actually at the bottom of the scrotum, but here the gubernaculum get fixed with this here, this called the labia majora. But at the same time you see that in case of the testis, in the scrotum there was a processus vaginalis also. So here in the case of the female there will be also processus vaginalis, and here this processus vaginalis will be present here. So processus vaginalis, there was a processus vaginalis, it came as a result of the diverticulum of the peritoneum, went into the into the inguinal canal, reaches up to the bottom of the scrotum where it forms the tunica vaginalis, and remaining tubular part of the processus vaginalis gets fused here to become like a thread here, one of the contents of spermatic cord. Same case here, because spermatic cord is not there but the processus vaginalis will remain there. So the processus vaginalis is actually present here. When the processus vaginalis, if for example in this case remains open or remains say fails to fuse here, but it is not obliterate here, will remain like a canal, you see that hernia can take place here also. So this means the persistent processus vaginalis, and consequently you see that there will be inguinal hernia may reach the labia majora here also. So the two very important relations will be there. One is called the round ligament of uterus, and another is the persistent I say processus vaginalis. This is again important from this point of view. So that means in case of inguinal canal, in case of female, it is not just say round ligament of uterus, but obliterated processus vaginalis also one of the contents, which usually we ignore, we do not write this, but it is there. But at the same time we have ilioinguinal nerve also, but usually we ignore processus vaginalis, it is there. So this is what we call here the labia majora. So this is another structure among the vulva is this. One is mons pubis, and there is labia majora, and the third you know that is the gap between the two labia majora. This is called pudendal cleft. And if you get past the pudendal cleft, you enter into another and you will come across another lips, you see that another set of say another pair of lips, this time you call them the minor lips, you call them labia minora. You say labium minus, previously it was labium majus, it is a labium minus. One is the labium minus, one we have got two, so that is why you call them labia minora. Very important, this is again peda fed, you see that they are smaller here, they are lying under that, you see, under that means deeper to them, and these are the two labia minora, you see that this is a labia minora. This is again folds here, these are again folds of the skin, but this time it is a non-hairy skin, and these are non-hairy skin, and this is in fact the two folds on two sides, labia minora, and again it will be like you see buttonhole type of gap between both of them. It is like a fish mouth, you see that, and if you pass through that you will come into a space, that space is called the vestibule, and if you actually look at this, this is called the vestibule. So gap between this is called the vestibule. So that means the vestibule is an area which is guarded from two sides by labia minora. This is labia. This is another thing you see after, this is the third thing that you are watching here, this is called the labia majora. This is one of many, I say, external genital organs. I say all these external genital organs together, you will find them in the perineal region, and all these structures you say these are called because the perineal skin, you see perineal region, the soft tissue perineum we have been actually calling in our previous lectures, soft tissue perineum starting you see from the mons pubis and we are going up to your anal region. This all is called a perineal region, and in this perineal region if you are actually looking at this, so you are watching here the external genital organs, labia minora, majora, pudendal cleft, you are going inside, you see labia minora, and between the labia minora, whatever space will come until you see the lower end of a vaginal opening here. This area you see that where it's not just a vaginal opening is actually opening here, a vaginal introitus is present, there is an entry into the vagina, but there are a lot of other openings also. And one of these openings you see that after vagina, it is now the opening that is called, here you see this is called urethral meatus. And all these structures which you are actually watching, these structures are called vulva. All the set of structures together collectively is called vulva. And we see that in history, you see that they say that, for example, VV is normal, means vulva vagina has been examined and they are found normal and nothing significant is present there. This VV. VV means vulva vagina. Vulva means all external genital organs here. And vagina means, so in obstetric and gynecologic histories, you see that in the history sheet, you will be watching here the vulva vagina means PV examination has been done, and vulva means all the external genital organs have been examined properly, and there is nothing significant, or if there is any positive finding, you have to actually write that. So vulva word means it is the set of all the external genital organs which you see in the perineal region after the vaginal introitus. And here I told you that the gap is there, and in the gap you are watching many structures. Many structures means one opening is this. This is now the blue color which you are actually watching here. This is an opening. This opening is called the vaginal opening, or you can say it is vaginal introitus. Entry into the vagina is through that. So this is another structure, this is called the vaginal introitus. The fourth structure you are watching is called the vaginal introitus. Is vaginal introitus. Just anterior to that you will find here another opening that is called the urethral meatus. Because these two major openings in the vestibule cordoned from two sides by the labia minora. So from two sides the labia minora is there, and between whatever gap you see here, that is called the vestibule. And in that vestibule is opening now the vaginal orifice, and anterior to the vaginal orifice or introitus we have got the urethral meatus. So another thing, that means you see here the fifth thing is the urethral meatus or urinary opening, or you can say urethral meatus. This is the fifth thing. Though this is not a genital organ, but because it is opening in the vestibule, so we call it the vulval organ also. It is one of the members of the vulva. So this is called urethral meatus. So this is called urethral meatus, you see. This is another opening. Very close to that. If you look at this, you see certain more openings you say. This is a question can be asked here. What are the openings in the vaginal vestibule? Openings, what opens in the vaginal vestibule? Which openings you see, or which holes or openings or orifices you see in the vaginal vestibule? One of that is the vaginal introitus by itself. Anterior to that will be the urethral meatus, through which you can pass the catheter also, with small, you see, small size urethra in case of female. And then you see on just between the vaginal introitus and the urethra, there are two or three, see, one or two openings on one side, one or two openings on the other side here. These are called the paraurethral glands. Paraurethral glands, you can call them even lesser vestibular glands also. They open in the vestibule obviously. These are called paraurethral glands, or these are called the lesser vestibular glands, or they can be called as the Skene's glands also. So this is another thing. This is sixth thing that is present here in vulva. It is paraurethral glands, or you can say lesser vestibular glands, or this is called Skene's gland. They are called paraurethral glands also, and they are basically the homologous to, in case of male they are not paraurethral. This paraurethral gland means urethra is there, these paraurethral glands develop into a big organ here, they surround that urethra, you call it the prostate. So that means in case of male, these paraurethral glands will give rise to prostate. So these are the homologous to the prostate in case of male. So all these structures you see in the external genitalia, every structure in the external genitalia in the vulva will have an equivalent, you see, homologous organ in the male. In the male, I told you there is scrotum, here you say this is labia majora. In case of male, you see, in case of female, it was a paraurethral gland, there will be prostate. In case of female, you see, it will be, say, these are called labia minora. In case of male, these labia minora will join together and will actually, because they are called the urethral folds, so they will join together and they will be elongated here and will elongate the urethra. So that means urethra will not stop here, urethra will elongate here, and that urethra will pass through the penis. This is called the penile part of urethra. So that means they will form the penile part of urethra. And here they failed to fuse and they gave here a gap. That's why the vestibule is created here. In that vestibule, urethra stops there and vagina will open also. But in case of male, you see that vagina and these all things are not present. And here, in this case, you are actually watching here. Watch this now. Another thing very important which will be present here is now you see the labia minora. If the labia minora posteriorly this labia minora, this will actually come and will join together to form here a kind of a commissure. This commissure is called the posterior commissure, but this commissure basically is called the fourchette. That is called the fourchette. This is the fourchette here. And this is the fourchette, this is actually present, and here this fourchette usually is a that underlies the perineal body. This is called a perineal fourchette. This is called the fourchette. This is here, but anteriorly it is different. Anteriorly, labia minora, if you see this labia minora, is passing on two sides of her, because the gap between the labia minora, this is called the vestibule, there is a gap. And in the gap already we have found here vaginal introitus, and at the same time we have found here the urethral meatus. On two sides of the urethral meatus, between vagina and the urethra, there are the lesser vestibular glands. And now you will see that very close here to the posterior wall, you see very close here to the vaginal introitus on its posterior end. Watch it here again. This posterior end, there are on either side of this you will find here a duct each, a very important duct, and that duct is actually the duct of the greater vestibular gland, that is called the Bartholin gland. So another thing here is called the Bartholin gland, means you can say the seventh structure in the vulva, it is the Bartholin gland. And this inflammation is called the Bartholinitis, greater vestibular gland. And when the duct is closed here due to some infection or anhygienic condition will lead here to the inflammation or infection, the duct gets closed and the secretion which is actually being secreted here, so duct gets closed and the gland, greater vestibular gland will become inflamed and will become infected, and secretion will be trapped inside and will remain and will become like a cyst here, and that cyst is called the Bartholin cyst. So Bartholinitis can give rise to the cyst here, this is called the Bartholin cyst, and here this will be the greater vestibular gland. That means the greater vestibular gland, if you are seeing this greater vestibular gland, that underlies here because it is lying here in the vestibule, and it has the duct which is opening into the vestibule, not in the lateral wall of vagina. Vagina is stopped there, and after that very close to the end of the vagina from the lateral wall in the posterior portion, this duct will open into the vestibule. That will lead here to plays a minor role in lubricating the vestibule during sexual intercourse. And here this will be actually present here like this. So another thing is the Bartholin glands. The seventh structure among the vulval structure is the Bartholin glands. And if you are actually looking at this here, now that means if the Bartholin gland is present and here is the labia majora, so the location of the Bartholin gland will be under the posterior part of the labia majora. So that means if this is here, I have cut here the part of labia majora to show you this Bartholin gland and some other things also, this green structure I will tell you later. But you see this one here, so if you are looking at this, so here it will be the gland here, this greater vestibular gland. So location of the greater vestibular gland will be the posterior part of the labia majora. So that means you can press here, if it is inflamed, you see the pain will be felt here in the posterior part of the labia majora. So here will be the gland here. Understand? So here is the gland, and when this gland becomes cyst here, so it will be visible here on the side of the vestibule. This is called the greater vestibular gland. A greater vestibular gland is called the Bartholin gland. Lesser vestibular gland is called the Skene's gland. These are paraurethral glands. These are all the openings which I have told you, that these are all the openings in the vestibule, and the vestibule urethra, and this vestibule is the area that is guarded by the two labia minora, and labia minora are the these are the folds here which have the fate. And now after discussing here the vulva or the vulval organs, like you have discussed the mons pubis, then we discussed its ramifications. You see posterior extension split up into two fatty pads here, we call them labia majora. Then labia majora has the anterior commissure, the posterior commissure, and the labia majora, they are split here, and the gap is in between a fissure, a cleft, you call them the pudendal cleft. We discussed this and we compared the labia majora with the scrotum, and we told you that embryologically how they develop. At the same time, we discussed here some more things. You see, when we go inside here, you have labia minora, and the labia minora, between that, whatever the gap is there, we call them the vestibule, and in the vestibule there are very important openings here. One is the major one, that is called the vaginal introitus, vaginal orifice. More anteriorly there is the urethral orifice, urethral meatus. Though the urethral meatus is not a part of genital system, but because it is lying in the vestibule, vaginal vestibule, we call it now vulval organ even. Then in the vicinity of the urethral meatus, there were lesser vestibular glands, Skene's glands, paraurethral, which are the homologous to the prostate in the male. And then close here to the posterior aspect, you see close to the posterior limit of the vaginal introitus, there was opening of the ducts of the greater vestibular glands, Bartholin glands you call them, and these are hardly, you see the two ducts, one duct from each side is coming. So these are the structures which open into the vaginal vestibule. But at the same time, you see that there was a labia minora. Posteriorly, labia minora, they fuse together in the region of the perineal body, means it will actually underlie the perineal body, means above that will be actually the perineal body. That is called posterior commissure, or the commissure of the labia minora, but we call them fourchette. And anteriorly, but it is different anteriorly. Why? Because it's anteriorly, each labia labium minus actually splits into the two folds here. The dorsal fold will fuse together to form here the foreskin, that will cover, that will overlap the glans of the clitoris, but the ventral fold will unite together to form here frenulum of the clitoris. These are certain areas which we discussed. Now the next thing that we should actually focus here, that we have given here or projected here the word the clitoris. You see the prepuce or the foreskin of the clitoris, the glans of the clitoris, and the frenulum of the clitoris. These things we have actually we have projected here. So we should know that what the clitoris itself is, how that is formed, where is it, because it is very important sexual organ. Because in the vulva these things are present, because this is a vulval organs, basically they are the genital organs, and they are performing the function of sexual excitement and other things also. If this is here, you see that if you are putting your concentration on this diagram, you will see this diagram. This is a lithotomy position. We are actually seeing this diagram, and we have already told you that this is the perineal view of the pelvis. I say perineal view means what you have removed here to see these structures: skin, fatty layer of the superficial fascia, and the membranous layer of the superficial fascia. You have removed here to see these things, and we already know that this is a diamond shaped boundaries of the perineum. This is, you see, pelvic outlet, the perineal view here, and in this perineal view, this is already we have seen this is a diamond shape, means this pubic symphysis, ischiopubic rami, ischial tuberosity area, and you see this is a sacrotuberous ligament area, and this is the tip of coccyx. So we have got this rhomboid shape, I would say this diamond shaped boundaries, and an imaginary line that passes across the ischial tuberosities, whose middle will be the central part of that line will be the area where above will be, I say at that area will be the perineal body. And in this area, if you are actually watching, so anteriorly the urogenital triangle, posteriorly is the anal triangle. So anteriorly the urogenital triangle which you are actually looking at, this is urogenital triangle where the urinary as well as vaginal introitus and all these things are present. Now in that area, if you are looking at this part, what you have removed from here, you have removed the skin superficial fascia fatty layer and the membranous layer, that is called the Colles fascia. And you are actually looking at this now. If you are looking at removing this, you are watching many things. You see in this here, there is a vaginal introitus, vaginal orifice, urethral orifice, and at the same time you see you have on the side of the vaginal introitus here, we have got the openings of the greater vestibular glands, ducts of the greater vestibular glands. You see this. And at the same time, more anteriorly here in the vestibule, we have urethral orifice, and in the vicinity of urethral orifice, we have got paraurethral glands opening here. These are the things. But at the same time, you see that. So that means this is the area of the vestibule. So this blue color which you are actually seeing, so this area will be the area of the labia minora, because labia minora will anteriorly will be fused with each other and posteriorly also fused with each other. So that means labia minora will be like this. Means it should be anteriorly fused and posteriorly also. Anteriorly it is fused, actually anteriorly is the fusion is different, posteriorly is fusion is different. Posteriorly it fuses here at the area of perineal body, you call that the fourchette, and anteriorly it will not fuse, actually it fuses, but it fuses not like in a single way, it fuses like this. Means anteriorly it splits like in two folds, dorsal fold, fusion to form the prepuce, that is called the foreskin of the clitoris, and posteriorly, say ventral, it will be fusing here with each other, it will form the frenulum of the clitoris, and in between will be the glans of the clitoris and the body of clitoris also. So that means to understand that in a better way, you should have a good knowledge about the basic anatomy of the clitoris, which is homologous to the penis in male. But there are differences. Differences means there are radical differences, a lot of differences will be there. Now if you see that, look at this diagram. Now in this picture especially, you see that in this picture you have removed, I told you that skin, fatty layer and membranous layer. But you see that if you have removed these structures, you are watching that. And if you are watching them, means you are seeing this structure and you are seeing this structure. You have removed superficial fascias, I say skin, superficial fascias, fatty and membranous layer. Means in this diagram, and in this diagram, difference is, if you have removed skin, superficial fascias, fatty layer and membranous layer, means you have removed labia majora and labia minora, you have removed, because these are the parts of basically the parts, these are the skin folds, these are the folds of it covered with the skin. One with the, say, labia majora with the hairy skin, and labia minora with the hairless skin, but they are removed. So this means you have removed, watch this diagram where these things are still intact. Here in this diagram it is still intact. Superficial fascia, consider superficial fascia, skin, fatty layer, membranous layer. You haven't removed here, means we have got here this labia majora, you have labia minora, and between the labia majora there is a pudendal cleft. Between the labia minora we have got the vestibule. All these things are intact here. These things are intact here. Similarly in this third, this diagram, third diagram, these things are also intact. You see, if you have gone here, this is labia majora, and if the labia majora is there, you see this is hairy skin. I am making hair here. This is skin here, these are thighs. So this is what? This is labia majora. If the labia majora, a cleft between labia majora, this cleft, this is the pudendal cleft. Means here both are intact, pudendal cleft. If you just open this pudendal cleft, you will gone inside here, you will come across labia minora. This is labia minora. So this was labia majora. I am removing it to show you this labia majora, and here is labia minora. If you have gone inside, you see through this labia minora, for example, if you remove them, if you retract them, if you have gone through this here, you have entered into the vestibule. This is the vestibule. means the area between the two labia minora, it is the vestibule. And in the vestibule, you know that in this diagram, because this is the coronal section cut at the middle of the genital system here, because the urinary system has been actually stripped off here, and you are watching the middle of the genital system. That's why you are watching here the vaginal introitus. Otherwise, in totality, you will see here even the urinary bladder and the urethral meatus also. But you are watching here this. That means Skene's glands and urethral meatus will not be visible here because this is the coronal section. And here what is visible, because you are cutting in the middle here, that is why you are watching the vaginal introitus. And on the sides you see on the vaginal introitus, because it is more posterior, so in the sides you will have the ducts of the greater vestibular glands, you call them Bartholin glands. So these are present here. So we are actually seeing this minora, majora, pudendal cleft, vestibule, etc. But you see the vagina is opening now. When the vagina is opening, the opening of the vagina is called the vaginal orifice that is open to the vestibule. It is closed by means of the mucosal fold that is called hymen. So you see this hymen is there. It is totally closed here. It is almost, it can be partially or completely closed. But when the menses starts, after the menstrual period starts here, this is perforated. If this is perforated, if it is not perforated, then it must be incised. And you see that this is called the hymen. Hymen is the mucosal folds which are actually closing the mouth, I say the opening of the vagina in the vestibule. And usually it has the hole, or it should be perforated, multiple holes, or it should be even disappear even. Sometimes back you see that even traditionally it is considered to be even the sign of virginity. But this is not true. Even in the virgin woman, this can be even absent. It should be just the few even mucosal tags should be there even. It's not necessarily it remains intact. When the menses starts, it should perforate it. It perforates the multiple holes, you see that. And even if it can even disappear, or it can be remaining only the tags here, you call them the hymenal carunculi. That can be just present like here. Especially when the menses start, or even the after parturition, this almost totally disappears and remains only a few tags, mucosal tags. So this is called the hymen. So if the hymen is present, you see it can be even perforated, I told you that. So this is called the hymen. Understand? So this is what we call here this vaginal introitus, and these things are there. Now if for example you look at this diagram and watch this. Here in this diagram, because you have removed the skin superficial fascias, fatty layer and membranous layer, means you have removed this. You have removed this. That means you are seeing these things, whatever things are visible here, they are visible here. Means you are actually looking from here. Looking from here means you are seeing the vagina opening along with the ducts of the greater vestibular glands. So you see this vagina here and greater vestibular glands. You see here urethral meatus as well as Skene's glands. Why don't you see here? Because this is coronal section, and this is in totality you are watching from the third position. And here you are watching only the urogenital area, and you are watching this urogenital area, but in the genital portion only, urinary not, because urinary will be more anteriorly, means outside the body you can see. So if this is here, so you are watching this area. Now in this area, look at this, because we are we will try here to actually understand what the clitoris itself is and how it is formed. Now clitoris can have two main parts. One is the foundation or the body of the, is called the root of the clitoris. Root of the clitoris means the things are attached with the under surface of urogenital diaphragm. And urogenital diaphragm, see in this diagram for example, urogenital diaphragm, you see here vagina, half of the vagina is lying above the pelvic diaphragm. See, this is a pelvic diaphragm, levator is passing through and comes into what? Comes into perineum. And when it comes into the perineum, you see it comes into the bony perineum. At the end of the bony perineum, there is urogenital diaphragm. This urogenital diaphragm. This green color is the upper facial covering of urogenital diaphragm, and this lower is the inferior facial covering. It's much thicker, you can say. It should be much thicker because it is called perineal membrane. And this is perineal membrane. And in between the perineal membrane, you see perineal, it is the perineal membrane. So above, below is the perineal membrane, above the superior facial covering of urogenital diaphragm. In between this red color which is actually shown here, this is called sphincter urethrae muscle, and more posteriorly will be deep transverse perineal muscles. Together you call them urogenital diaphragm. So, vagina passes through that. It will penetrate the inferior facial covering, that is called the perineal membrane. So, it will be for some while, you see that for short distance it will remain within the deep perineal pouch. So, it will be content of the deep perineal pouch, and surely more anteriorly urethra is also passing. So, it will be also a content of a deep perineal pouch. And at the same time, when it is penetrating or say piercing the perineal membrane, it will come into superficial perineal pouch. I have told you that what it will be actually present until after that what will come? After that there is a membranous layer, and we told you that it is not just membranous layer, then is the fatty layer, and the last will be the skin. So, until the membranous layer comes, between perineal membrane and the collis fascia, the membranous layer, what is there? Superficial perineal pouch, means vagina has come into superficial perineal pouch. A superficial perineal pouch means where it has come? It has come in the vestibule in the same, because on the two sides will be the labia minora, which we have removed. And in this structure, so vagina has entered into the vestibule, and vestibule and is a vaginal introitus that was covered by, we told you that is covered by the hymen. This is hymen, and here this is actually present. And once it comes into the vagina, comes here into the, it penetrated the perineal membrane, it comes into superficial perineal pouch. In the middle it is present, though anterior is present, urethra also. On sides you will see these four structures. Two structures will be just on two sides of the vagina, and remaining two structures will be close area to the ischiopubic rami. These are the four contractile spongy structures. Out of this you can see on that side, you see in this diagram you are watching, if this is here very close here and it is coordinating or supporting the last part of the vagina, this one, this blue color, here it has been shown in green color like this, this one. This one, and here you watch this blue color you are watching. Okay, make it green, no problem, but you watch it here. This is spongy structure. This is called bulb of the vestibule. And bulb of the vestibule will not just be present here at one side, it will be present on the other side also. And bulb of the vestibule means this bulb of the vestibule is supporting the last part of vagina which has entered into the vestibule. That's why I call the bulb of the vestibule. And bulb of the vestibule or the last part of vagina, they are present in superficial perineal pouch. So, if anybody asks you the superficial perineal pouch contains, you can say the bulb of the vestibule. Not just the bulb of vestibule, but the last part of the vaginal introitus is present there also. This is all vestibule area, but this is superficial perineal pouch, because the next structure that will come is the collis fascia. And quite superiorly you have got the perineal membrane. So, between superiorly perineal membrane and below the collis fascia, you are actually in superficial perineal pouch. But above the perineal membrane, where your muscle is, sphincter urethrae is present until the superficial, I say superior facial covering comes, this is the deep perineal pouch. Means through the deep perineal pouch, very short distance the vagina passes, but vagina penetrates or pierces through the perineal membrane to come into the superficial perineal pouch and immediately finishes and hymen comes. But you know that it is the last portion is supported from two sides by the bulbs. These are called the bulbs of the vestibule, one on either side. This is present on one side, on other side it hasn't been shown to you. But you see that we don't have, these are spongy structures, which you will actually more understand. We will take up nervous system, we will see here the erection and ejaculation, emission and all these things. Then you will actually understand what this is. So, this is something that is called the bulb of the vestibule, but we don't have just the two bulbs here on the two sides, but at the same time closer here to the bones, ischiopubic rami, because you are in the urogenital diaphragm, you are in the urogenital triangle area. So, on the sides it is bounded here by the ischiopubic rami. So, very close to the ischiopubic rami, attached to the ischiopubic rami here, there is again a spongy structure, one on either side. This is called this one is called the crus of the clitoris. This one, this green color which you were shown, this is called the crus of clitoris. Clitoris, which is the homologous to penis in the male. This is crus of clitoris, but this one which I have told you that is called the bulb of the vestibule. This is not called bulb of clitoris because it doesn't contribute too much in the clitoris formation. This is called bulb of vestibule. both among the contents of superficial perineal pouch. On either side you are seeing, and the same side you see on the other side also, both similar two structures are present. You said why we are not visualizing, you see why we don't see these structures on that side. We don't see these structures on that side. Why? The reason is that because we have actually this bulb that is called the bulb of the vestibule, it is covered by this muscle. You see this red color muscle which I am actually darkening here. This red color muscle, this is covering here. This muscle is called a bulbospongiosus muscle that surrounds the sides of the vagina. That surrounds the vestibule, you see that, but it surrounds the sides of the vagina. Now you can see this is called bulbospongiosus muscle. From this side in the bulb of the vestibule, this muscle has been removed to show you this green color. Otherwise, this muscle is present here also. But if I will put this muscle here, this green color bulb you will not be able to see because this will be covered by this muscle. To show you actually both structures we have made. On this half we are showing you the muscle, on this half we are not showing you the muscle, so that the underlying structure you can see. If this is here, but you see this is called here the crest of the clitoris. Here on that side the crest of clitoris is also there, but that is covered by means of another skeletal muscle. This is a muscle that is present here, that is attached here to the side of the to the bone here, ischioepigramus. So I am actually making it more darker red. This is another muscle. This is called, this muscle is called ischiocavernosus. This is called bulbospongiosus. And this one is called ischiocavernosus. So two muscles are there. These are two muscles, but at the same time you see this bulbospongiosus. Posteriorly it is attached here to the perineal body. These are all these two muscles, not just the bulb and the crest, but these two muscles are also among the contents of superficial perineal pouch in case of female, and they are present in case of male also. And if this is present here, you see that now all these structures, the two muscles on this side, two muscles on this side, two spongy structures on this side, two spongy structures on that side, all they are central structure. It is attached above with the perineal membrane, and posteriorly the central structures are attached to the perineal body also. But the side structures which are attached above to the perineal membrane, but on the sides to the bone. Bone is the ischioepigramus, and they are among the contents of superficial perineal pouch. And among the contents of superficial perineal pouch are other things also. Urethral meatus, I say urethra comes here, and you see vagina also. Ducts of greater vestibular glands, and themselves greater vestibular glands themselves are also in the superficial perineal pouch. You see, if for example you are watching, see this diagram, watch and compare this. I say vagina, urethra, skin glands, and you see here greater vestibular gland ducts. Greater vestibular gland ducts, vagina, urethra, skin glands are not present here. On two sides are present the bulb covered with the muscle. You see this bulbs covered with the muscle. Still on the two sides closer to the ischioepigrama, they are again the crest of the clitoris, covered with the muscle. That is the muscle is called the ischiocavernosus. All these are in the superficial perineal pouch, but at the same time, more posteriorly, hidden, you see, partially hidden under the bulb here, bulb of the vestibule, there is a gland whose name is the greater vestibular gland. You see, greater vestibular gland hidden in the bulb of vestibule. But you see that the ducts will come out now. Well, ducts will come out, and where they will open? They will open here on the side of the vaginal introitus within the vestibule. You see the ducts are opening here. And they play some, you see, minor role in lubricating the vestibule here during sexual excitement. And if you see these structures here, these are the structures included in superficial perineal pouch. But watch here. The question is how clitoris is formed. Clitoris basically is formed from this. This is called the bulb of, I say this is called the crest of the clitoris. This crest of clitoris, which I am actually showing you here, which is attached here to the perineal body as well as to side to the bone also. When it comes from sides here, both of the crura here, both of the crura of the clitoris, one is called the crest and two are called the crura. If the crura are coming here, they fuse in the middle, just under the pubic symphysis. But not just fuse in the middle, they will form, you see, some free ends now, they will actually leave the perineal membrane. leave the perineal membrane after fusion. Once they were attached to the perineal membrane, you see, when they were attached to the perineal membrane and also to the bone, they are called the root of the clitoris. But once they will actually fuse and leave them, this small even this called portion, that is called the body. And this time their name will not be the crus of the clitoris. This time their name will be carpora cavernosa. One is called the carpus cavernosum, another called the carpus cavernosum. Both are together because they fuse to form a single thing, very small miniature carpora cavernosa, because these carpora cavernosa in case of male, they are elongated and they form the body of the penis there in case of male, but in this case of female they are forming in the body of the clitoris, very small. So that means the crus of the clitoris is becoming continuous with the carpus cavernosum, and two are called carpus cavernosa, and this small one is called the body of the clitoris. But the body of clitoris is not yet finished because the two spongy structures still are waiting. These are called the bulba of the vestibule. Why don't you call them bulba of the clitoris? In case of male we call them the bulba of the penis, but here don't call bulba of penis because they do not contribute too much in the clitoris. Because you see, this crus of the clitoris becomes continuous with that small structure that is called the carpus cavernosum. So the bulba of the vestibule must be continuous with the carpus spongiosum. This happens in male, but here it doesn't happen. Carpus spongiosum is not present in female. So that means in clitoris carpus spongiosum is not present. So it is not contributing. In female, I say in male it contributes. Because after the bulba of the vestibule, I say bulba of the penis, there that elongates to become carpus spongiosum, and in the end it will become bulged to form the glans of the penis. Through the bulb, through the carpus spongiosum, I say through the carpus spongiosum, and then through the glans of the penis, urethra travels. This is called the penile part of urethra. But here urethra doesn't elongate, urethra finishes at the vestibule, doesn't come forward. And urethra doesn't come forward, so it will stop here. If it stop here, and who causes the elongation of urethra? Labia, minora, these are called the urethral folds. They come forward here. In case of male, to elongate the urethra, to elongate the penis here, but here it doesn't happen. Labia minora stop there, so elongation of urethra will not take place. Urethral meatus stops here, so it will be short urethra. And here these things are there. So that means if this is the bulb, we don't call it the bulb of the clitoris, we call the bulb of the vestibule. And this bulb of the vestibule will come anteriorly. Posteriorly it is separate, but anteriorly you know that it comes and will fuse to form a small nodular structure that will join, you see, that will join ventrally, it will actually join the carpora cavernosa. You call it the glans. This is called the glans of the clitoris. And you see that, so that means the body of the clitoris will be the fusion of the two carpora cavernosa and addition of the glans of the clitoris. Glans of the clitoris, it is too much, you see, sensory, too much sensitive area, and for sexual excitement it is very, very important. And this glans of the clitoris and the body, you know that this is covered by means of the prepuce or the foreskin, which is nothing but fusion of the dorsal, we say fusion of the dorsal fusion. You see that fusion of the anterior fusion of the two labia minora dorsal folds here. But the ventrally you all already know that is called the frenulum of the clitoris, because anteriorly labia minora splits into the two. Dorsally forming the foreskin, that will be above the, yes, it will cover the glans of the clitoris. And glans of the clitoris, sometimes this foreskin is so large, sometimes in some women is so large that even the circumcision is sometimes even done even the female in certain nations and certain races, because it will totally even covers the glans of the clitoris. Just like in the male, you see glans of the clitoris is totally covered with the foreskin, prepuce, and this you know that religiously it is necessary to get this foreskin cut here, that is called circumcision. And sometimes in female is done, in certain races the circumcision is done. And sometimes we have heard somewhere that even the glans of the clitoris to actually remove the sexual excitement from the women, some races, even the tribal races, they used to even cut even the glans of the clitoris also. We have heard somewhere, even read some in some literature. As for the parts of clitoris are concerned, there are 4 spongy structures, 2 on the sides, 2 in the center, but not in the center, fused with each other, and the gap there, because through the gap is entering the vagina, last part of vagina. That is why these 2 are called the bulbs of the vestibule, and the 2 other which are to the sides, they are called the crest of the clitoris here. So, crest of the clitoris on 2 sides and bulbs of the vestibule on in the center on 2 sides of the vagina. This together, all these 4 structures are called root of the clitoris. If they are the root of the clitoris, then what is the body? These 2 structures which are actually on the sides here, when they are attached with the perineal membrane and the bone, they are coming like here, but when they come here under the pubic symphysis, you see that they both of them will fuse and they will leave now the perineal membrane to form here a free floating, you see that free body here, small though. In case of male it will be very long, but in case of female it will be very, very short. That will be called as the body of the clitoris. And that body of the clitoris, though it is not fully finished here yet, but it has been formed by what? By the continuations of the crura of the clitoris. The crest of the clitoris on one side, crest of the clitoris on the other side, 2 together is called the crura. And when they will leave now the perineal membrane to form the body of clitoris, but this time you will call them not the crura, but you call them corpus cavernosum. On one side, corpus cavernosum, on other side, they fuse to form the single small structure here, that single small structure here like small. You call it body of the clitoris. By the fusion of the 2 corpora cavernosa, you say corpora cavernosa, corpus cavernosum, one corpus cavernosum, another. They both join together to form a single body, that is called the corpus, is called the corpora cavernosa, and their fusion will form now the body of clitoris. And they themselves are continuous with the crest of, crest of the clitoris. The crest of clitoris will become continuous with the corpus cavernosum. So, crest of clitoris, that is the part of the root of clitoris, and corpus cavernosum, which is its continuation, it is the part of the body of clitoris. But the body of clitoris is not yet finished, because still we have got 2 more spongy structures. One is called the bulba vestibule on one side, bulba vestibule on the other side. Posteriorly they are separate, but anteriorly they are fusing together, and after fusion ventrally they will contribute little bit. You say ventrally they will just form a nodular structure, rounded structure, you call them glands of the clitoris. So, glands of the clitoris will aid in the body of the clitoris. But this time we will not call it now, it is the continuation. Behind you see the bulb of vestibule, but anteriorly when it will become a part of the body and form the glands and will be a part of the body of clitoris, but still you will not call it now the corpus. In male you call them corpus spongiosum, but in female we do not call it corpus spongiosum. That means in clitoris body corpus spongiosum is not there, just the glans is there. But in case of a male, this bulb of the vestibule, which we call it here, we do not call it the bulb of the clitoris. In male we call them bulb of penis also. We call this the bulb of the vestibule, we call this the crest of the penis. Here crest of clitoris, there crest of penis. Here we call them bulb of vestibule, but there we call them bulb of penis. And bulb of penis is anteriorly becoming continuous with corpus spongiosum. Here corpus spongiosum is not there. So, clitoris does not be contributed by corpus spongiosum, because corpus spongiosum is not present in female. In female, glans of clitoris is present, and we told you that in this area is present here. Now, this bulb of the vestibule which we are showing you here, this is actually covered with the muscle obviously, and muscle is covered here in this zone. The muscle will be covered by the labia majora. Means this area which you are watching, this area from surface point of view, from surface marking point of view, this area, if we are pressing your labia majora, means we are pressing basically the bulbospongiosus muscle, and underneath will be bulb of the vestibule, a little posteriorly, under the posterior part of the labia majora will be the greater vestibular glands. And the greater vestibular glands will fill a form and will give them ducts, and ducts will penetrate inside. They will penetrate the side of the vestibule, very close here to the end of the vaginal introitus, just inferior to the hymen. You see they are opening here. So, all these structures will constitute the superficial perineal pouch structures, and they will be antiperineal pouch already you have seen. Maybe we will discuss the superficial and deep perineal pouch separately, but if you do not discuss that separately, still you see in case of female the vagina, the urethra, skin glands, greater vestibular glands, ducts, greater vestibular gland itself, spongy structures is called the bulb of the vestibule, you say crest of the clitoris, their muscles. At the same time, you see not just this muscle only, but this muscle also. This green color dots which we are showing here, this is perineal membrane, because you are seeing above, this is the perineal membrane. Now all these structures are attached to the perineal membrane, and in this area you are actually watching light. Now in this, especially when you are actually discussing this one, so we have like this, and in this structure, in the superficial perineal pouch, you are watching some muscles also, and among these muscles, the muscle which is present here, this is superficial transverse perineal muscle attached to the perineal body. Bulbospongious muscle attached to the perineal body, but ischio-cavernous it is not attached because it is on the sides. And this is superficial perineal pouch, and inferior to the superficial perineal pouch, boundary will be the Colles fascia, and we told you that when the Colles fascia comes back here, it will attach here to the free posterior border of urogenital diaphragm, and its central portion is having the perineal body, means Colles fascia in the middle is attached here to the perineal body also. Not only this, but at the same time, perineal membrane which is attached here under the sphincter urethrae and deep transverse perineal muscles. The perineal membrane is attached here, and posteriorly perineal membrane is attached to the central portion, which is again the perineal body. So structures attached to the perineal body is this. But still above that, we have got a sphincter urethrae muscle. It is too away here, too anterior, so it is not attached to the perineal body. But little posterior, there is a deep transverse perineal muscle attached to the central portion, is attached to the perineal body. And above that, this is nothing but the urogenital diaphragm, and above that is the levator ani muscle. Levator ani muscle is mostly anterior pubococcygeus. You call them the levator prostati, or you can call them the sphincter vaginae muscles. They are attached here again to the perineal body. So from superficial to deep, you can go above and you will see how perineal body is giving attachment to certain structures. At the same time, if you see the vagina here, vagina half is above the perineal, I say levator ani, half below that. Half above the pelvic diaphragm means half below that, half in the pelvic cavity proper, half in the perineum, and it is passing through urogenital hiatus of the levator ani muscle, or you say pelvic diaphragm, means it is supported by the pelvic diaphragm. Number one support of the skeletal muscle to the vagina, indirectly to the say cervix and to the uterus is the levator ani. When it comes to vagina, it passes through the urogenital diaphragm, sphincter urethrae, by penetrating through the superior facial covering, then leaving it through by piercing the perineal membrane. Again, this will be supported here by the sphincter urethrae muscle. Second skeletal muscle is supporting it. And once it is coming out of the deep perineal pouch, immediately the bulbs are supporting them. Not just the bulbs are covered with the bulbospongious muscle. A pair of bulbospongious muscles are supporting them. On the back side, surely the vaginal last portion will be supported here even by, you can say, by a perineal body also. So three muscles from above downward, they are supporting the vagina and indirectly the cervix and also the uterus. And these are part of the pelvic floor, you can say. So when you will actually be discussing them, you see, and all these structures which we have discussed, they are called the external genital organs in the female, and together you call them vulva. And the vulva, you have seen the mons pubis, number 1, number 2, labia majora, number 3, pudendal cleft, number 4, if you will enter inside, labia minora, then number 6, the space that is called vestibule. In vestibule you have seen 7th number is the vaginal introitus, then is the urethral meatus, skin's gland is 9th, 10th is the greater vestibular glands, their ducts, these things you have seen, and then all important, you have to actually watch here the structure of the clitoris, and you have to compare that with the structure of the penis when you will discuss the male external genital organs. Usually I have noticed that students, after doing the internal genital organs, they usually ignore the external genital organs. They are very important. You see, many diseases they are related. When you actually go in the gynecology and obstetrics, you see, and in gynecology you will see the examination of the vulva vagina. That is not just the vagina which is actually examined and then the internal genital organ, but the vulva has to be examined properly. Vulva vagina. That means you have to VV. See the V/V. We say the V/V insignificant. We say significant, or any findings which are present. So vulva is important. You should actually have a clear-cut idea about where these structures are there and how these structures are corresponding with each other. And if you on the surface you are seeing a labia majora, if you cut the labia majora, what will come next? Under the labia majora, what is present? So that we should have concept If the greater vestibular gland enlarges and becomes inflamed, where the redness will be there? Because you see that is lying under the labia majora. You see under the labia majora is the bulb of the vestibule, and closer to the posterior end of bulb of vestibule is lying the greater vestibular glands. Means in the posterior end of, you see here some part of the labia majora has been, labia majus in this side has been cut here to show you the posterior part of this green color, the posterior part of the bulb, and under this bulb is actually lying here this black color, that is called the greater vestibular gland. And if you are returning back again, so that means this greater vestibular gland will be in this surface area. So that means here you can feel it. If this is the redness, so redness will be in this area, and you are seeing this, and you know that is lying actually within the vestibule, in the bulb of the vestibule, in superficial perineal pouch, so in the contents of superficial perineal pouch will be there. This was the class today about external genitalia, vulva, and we have actually seen all these structures today. The class is finished.